Imagine a tiny organ tucked away in your gut, so small and mysterious that doctors once thought it had no real purpose. For most of your life, you probably never gave it a second thought, until now. This little pouch, known as the appendix, has quietly become the center of a growing medical mystery. Once considered a biological leftover with no major role, it is now at the heart of a surprising health trend. Cancer of the appendix is showing up more often, and it is striking people far younger than ever before. Not long ago, this condition was so rare that many physicians would go their entire careers without seeing a single case. It was the kind of diagnosis reserved for textbooks and medical trivia, a footnote in the world of oncology. But today, something has shifted. More and more, doctors are finding tumors in the appendix during routine surgeries or while investigating unexplained stomach troubles. And the patients are not just older adults. They are in their 30s, their 40s, even younger. People who eat well, live active lives, and have no family history of cancer are suddenly facing a disease they never knew existed. The numbers tell a quiet but alarming story. While still uncommon in the grand scheme of things, cases of appendix cancer have climbed sharply over the past few decades. The increase is most noticeable among those born after the 1970s, suggesting that something about modern life may be fueling this rise. Unlike colon cancer, which has screening tools like colonoscopies to catch problems early, appendix cancer hides in silence. There is no test, no standard imaging method that reliably spots it before symptoms appear, and by then, it may already be advanced. What makes this especially troubling is how easily the signs can be missed. The symptoms, bloating, mild abdominal pain, changes in digestion, are common to so many everyday issues that most people brush them off. A bit of gas, a little discomfort, an off day in the bathroom, nothing seems serious enough to warrant a trip to the doctor. But when these vague complaints lead to surgery for what looks like a simple case of appendicitis, the real shock comes later, under the microscope. That inflamed appendix removed in a rush might not have been just infected, it could have been harboring cancer cells all along. This silent nature of the disease means awareness is everything. Without public knowledge or routine screening, the burden falls on individuals to trust their instincts when something feels wrong. Yet how do you know when bloating is just bloating, and when it might be a warning sign? Therein lies one of the biggest challenges. Medicine relies on patterns, on red flags, on risk factors. But appendix cancer does not follow the usual rules. It does not wait for age, for genetics, or for obvious symptoms. It appears quietly, spreads subtly, and often goes undetected until it is harder to treat. So what is driving this change? No one has a definitive answer, but clues are beginning to emerge from the way we live now. Consider the transformation of daily life over the last 50 years. Food has changed. Movement has changed. The environment around us has changed. These shifts may seem minor on their own, but together, they could be reshaping human health in ways we are only starting to understand. Take diet. The meals most people eat today look nothing like those of previous generations. Fresh produce and home-cooked dishes have given way to convenience foods loaded with preservatives, added sugars, and processed ingredients. Fast food, sugary drinks, and packaged snacks dominate pantries and lunch breaks. These foods are not just less nutritious, they may actively harm the delicate ecosystem inside the gut. The digestive tract is home to trillions of bacteria that help regulate immunity, digestion, and even mood. When that balance is disrupted by poor diet, inflammation can rise, and with it, the risk of abnormal cell growth. Then there is weight. Obesity rates have skyrocketed since the 1970s, and excess body fat is linked to a host of cancers, including those in the digestive system. Fat tissue is not inert. It produces hormones and inflammatory signals that can influence how cells behave. In this environment, the likelihood of mutations and uncontrolled growth increases. Combined with sedentary lifestyles, hours spent sitting at desks, in cars, in front of screens, the body's natural defenses weaken over time. But the story likely goes beyond diet and exercise. The world itself has changed. Chemicals once unknown or rarely encountered are now everywhere, in plastics, in packaging, in water, in the air. Some of these substances can mimic hormones or interfere with cellular processes in ways that may promote cancer development. Water supplies, even when deemed safe, can carry trace amounts of pharmaceuticals, microplastics, and industrial runoff. While individual exposures may be small, the cumulative effect over a lifetime is still unknown. Another suspect in this mystery is the microbiome, the vast community of microbes living in the intestines. Scientists are learning that these tiny organisms play a crucial role in maintaining health, training the immune system, and protecting against disease. But modern life has put immense pressure on this internal world. Antibiotics, while life-saving, do not discriminate between harmful and helpful bacteria. Their widespread use, both in medicine and in agriculture, has altered the microbial landscape, possibly making the gut more vulnerable to dysfunction and disease. Early exposure to antibiotics, especially in childhood, may have long-lasting effects that ripple into adulthood, setting the stage for conditions that were once rare. This broader pattern is not unique to appendix cancer. Other gastrointestinal cancers, such as those in the colon and stomach, are also appearing more frequently in younger adults. This suggests a shared underlying cause, a common thread woven through the fabric of contemporary living. It is not one single factor but a web of interconnected influences: what we eat, how we move, what we are exposed to, and how our bodies respond at a microscopic level. Despite the lack of answers, there are steps people can take to protect themselves. Prevention remains the best tool available. Eating a diet rich in whole foods, vegetables, fruits, legumes, and fiber supports a healthy gut and reduces inflammation. Staying physically active helps maintain a strong metabolism and balanced hormone levels. Limiting alcohol, avoiding tobacco, and managing stress all contribute to overall resilience. These habits do not guarantee safety, but they build a foundation of health that can lower the risk of many diseases, including cancer. Equally important is paying attention to the body. Too often, people dismiss persistent discomfort as normal, temporary, or not worth mentioning. But the body communicates through sensation. Pain, bloating, fatigue, changes in bowel movements, these are not just nuisances. They are signals. When symptoms linger or worsen, especially in someone under 50, they deserve investigation. Waiting too long can mean missing a window when treatment might be most effective. Doctors also have a role to play. With appendix cancer becoming more common in younger patients, medical professionals must expand their thinking. Age should not rule out serious conditions. When a young person walks in with ongoing stomach issues, the assumption should not automatically be stress or indigestion. A deeper look may be needed. Greater awareness among healthcare providers can lead to earlier diagnoses and better outcomes. Research is slowly catching up. Scientists are working to understand why this cancer is rising and who might be most at risk. Studies are examining genetic markers, environmental exposures, and gut bacteria profiles in search of patterns. The goal is not just to explain the past but to prepare for the future, to develop better detection methods, targeted treatments, and ultimately prevention strategies tailored to the realities of modern life. In the meantime, the story of appendix cancer serves as a powerful reminder that rarity does not equal impossibility. Just because a disease was once uncommon does not mean it will stay that way. Human health is deeply connected to the world we create, our food systems, our cities, our technologies, our habits. When those systems change, our bodies respond, sometimes in unexpected ways. This quiet rise in appendix cancer may seem like a small ripple in the vast ocean of global health. But ripples can grow into waves. What begins as a puzzling trend in a forgotten organ could signal larger shifts in how our environment interacts with our biology. It challenges the assumption that progress always leads to better health. Sometimes, progress brings new risks disguised as convenience. The message is clear: pay attention. Not just to headlines or scare stories, but to your own body, your choices, and the world around you. Health is not just the absence of disease. It is an ongoing conversation between you and your environment. Listen closely. Ask questions. Seek answers when things feel off. Because sometimes, the smallest part of you, the one you never thought about, might be trying to tell you something important. And in a world where new health threats emerge silently, awareness may be the most powerful medicine of all. If you found this video eye-opening, don't keep it to yourself. Hit that like button, subscribe, and turn on the bell so you never miss another story that could change the way you think about your health. The rise of appendix cancer might seem rare, but it's a powerful reminder that our bodies are constantly responding to the world around us. By staying informed and listening to the signals, we can take control before small issues become big problems. Share this with someone you care about, because sometimes, the most important warnings come from the places we least expect. See you in the next one.